Luteinizing hormone stimulates the testes in males and the ovaries in females. This hormone is vital for reproductive health, with both high and low levels associated with low fertility and other reproductive issues. Luteinizing hormone is a hormone that's released by the pituitary gland in response to luteinizing hormone releasing hormone. This is released from the hypothalamus. The luteinizing hormone is a gonadotropic hormone, and it controls the function of the female ovaries and the male testes. It's also essential for the proper reproductive function. In males, it's also called the interstitial cell stimulating hormone. In general, when estrogen and progesterone levels fall, the luteinizing hormone rises. Follicle stimulating hormone is synergistic with luteinizing hormone. In women, luteinizing hormone carries out different roles in the two halves of the menstrual cycle. In weeks 1 to 2 of the cycle, the luteinizing hormone is required to stimulate the ovarian follicles in the ovary to produce the female sex hormone estradiol. Later, a surge in luteinizing hormone level causes ovulation. In the remainder of the cycle, the luteinizing hormone stimulates the corpus luteum to produce progesterone, and this is required to support the early stages of pregnancy if fertilization occurs. Luteinizing hormone stimulates the Leydig cells in the testes to produce testosterone. If testosterone levels decrease, the luteinizing hormone increases. This is known as a negative feedback. Testosterone, in turn, stimulates sperm production as well as generating male characteristics throughout the body. A luteinizing hormone test measures the amount of luteinizing hormone in a sample of blood or urine. It might be done to find the cause of a couple's inability to become pregnant. Luteinizing hormone test is commonly used to evaluate a woman's egg supply, a man's sperm count, menstrual problems in women, and a woman's response to medicines taken to stimulate ovulation. Depending on the sex, the phase of the cycle, or other factors, normal luteinizing hormone blood levels can vary. For women in the follicular phase of the menstrual cycle, it's 1.9 to 12.5 IUs per litre. For women at the peak of the cycle, it's 8.7 to 76.3. For women in the luteal phase of the cycle, it's 0.5 to 16.9. For pregnant women, less than 1.5. Women past the menopause, 15 to 54. Women using contraceptives, 0.7 to 5.6. Men between the ages of 20 and 70, it's 0.7 to 7.9. And men over 70, 3.1 to 34 IUs per litre. Luteinizing hormone levels are a marker of reproductive health. Lower high levels don't necessarily indicate a problem if there's no symptoms or if your doctor tells you not to worry about it. The luteinizing hormone deficiency is uncommon on its own. A luteinizing hormone deficiency almost always occurs with follicle-stimulating hormone deficiency because the hormones are secreted by the same set of cells. Signs and symptoms are an irregular or absent menstrual period in women, loss of body and facial hair in men, erectile dysfunction and decreased libido in men, and infertility in both men and women. Potential causes are hypopituitarism, hypogonadism, delayed puberty, and Kallman's syndrome caused by a deficiency in gonadotropin-releasing hormone. This can result in a lack of sexual development, a small penis, underdeveloped testes, and a delay or a lack of puberty. Other causes are smoking cigarettes and cannabis, vitamin D deficiency, tumours in the pituitary gland, and digoxin treatment. Improving your luteinizing hormone levels won't necessarily cause an improvement in reproductive health. The following is a list of complementary approaches to improve the reproductive health that can also balance the low luteinizing hormone levels. When it comes to lifestyle changes, you can stop smoking cigarettes and marijuana. Some supplements are D-aspartic acid, forskolin, resveratrol, omega-3, vitamin D, garlic, and for men, licorice. High luteinizing hormone levels may cause fertility problems. Some women with high luteinizing hormone have lower rates of fertilization and pregnancy. In men, high levels might indicate testicular failure and infertility. High luteinizing hormone can be seen in the genetic condition known as Klinefelter's syndrome. It shrinks the testes and causes them to not produce enough testosterone. In postmenopausal women, an increase in luteinizing hormone can play a role in Alzheimer's disease development. The luteinizing hormone has been shown to promote the deposition of amyloid beta plaque in the hippocampus, as can be seen in Alzheimer's. Some signs and symptoms are absent or irregular menstrual cycle and infertility in both men and women. Some potential causes are polycystic ovary syndrome, early precocious puberty, genetic abnormalities or mutations in the luteinizing hormone chronic gonadotropin receptor that causes ambiguous genitalia and infertility, tumours in the ovaries and thyroid disorders. Testicular failure can also cause high luteinizing hormone levels. This can be caused by thyroid disorders, chromosomal disorders, radiation therapy, radiation, tumours and viral infections. If you've high luteinizing hormone, one way to improve reproductive health is by exercising regularly. Some supplements that can help are black cohosh, Vitex agnus castus or the chaseberry, and for women, licorice. Testosterone can inhibit the luteinizing hormone, so check your testosterone levels and lifestyle and supplement suggestions associated with testosterone. To book a consultation or to learn about hormones, herbs, supplements and natural treatments, check out my website.